So when someone begins their journey on starting Ozempic or Zepbound, do you recommend that the person also wear one of these just to be on the safer side? Hello and welcome to my show. My name is Rishankajones, and today I have with me Dr. Kartik Desai. He's a primary care doctor and has been in the field for almost 18 years. But today he's going to be talking to us about the obesity pandemic and the revolution of different modalities that are used to treat obesity. Welcome, Dr. Kartik.
Oh, thank you very much. It's such a pleasure to have you in the office as we are managing this very complex situation of obesity pandemic. And I think it's an excellent topic to discuss today because it has a huge impact on economy, on the healthcare. But
Thank you so
thank
much.
you for selecting this wonderful topic.
Yeah, I mean, this is a topic that at least my age, the generation is really into and has been very closely following the medications for obesity. So I just thought that it's a great topic to discuss with a professional like yourself and really get the correct information out for people there. And today, Dr. Desai, before we begin to talk about all the medications which are there for obesity, in very few words, if you could just explain exactly what is obesity.
Excellent questions. Obesity is typically classified into overweight obesity and morbid obesity in combination with a different adverse effect, mainly leading to diabetes mellitus, type 2 mostly, hyperlipidemia, hypertension, and sleep apnea. And it has an impact on professional life, personal life, social life, big impact on the financial management, and there's a good news that it is manageable. So there is a formula that we use called body mass index, not absolutely accurate, but based on the height and weight, there's a specific number will come out called body mass index. And there is a criteria of low weight, normal weight, that's where it ranges between 20 and 25. About 25, it's called overweight. About 30, it's called obesity. And then we go forward from 35, 40, called morbid obesity. But there's a little complex component. So if the patient is overweight and has more than two medical conditions, for example, hypertension, diabetes, or diabetes and lipids, or there's a one component between 30 and 35, that lead to a complex classification of the obesity. So basically it's based on one number, but there are other factors that might contribute.
Okay, so now that we know what obesity is, and you said that there are many different factors that could contribute it.
Sure.
It's not just overeating, it could be
No,
an underlying
no.
health condition that could basically
So
lead
that's a very good point that there are many factors starting from genetic to availability of the food, the type of lifestyle.
PCOS, I've heard is.
Yeah, there is a PCOS is one, for example. Hypothyroid is very common that we see linked with the obesity and overweight. It also associated with who is cooking food and how you get the food, right?
So moving on to what are the options available for people right now who consider themselves obese and want to treat it by using medications and not wanting to make significant changes in their lifestyle, whether it's food or going to the gym or physical activity. If you could also, Dr. Desai, rate those medications from 1 to 5, which is best, which is the second best, and when you're rating those in the context of which has the least side effects.
Very nice. An excellent question. People come to us and the first question they ask that, am I candidate? And the first thing we explain that what is your medical status? What is your BMI? What is your blood pressure, your cholesterol? So we like to get the blood work done and see that any those factors are contributing to the obesity. Then we also talk about the lifestyle, physical activity, and work status, and are they working the regular hours or working off hours? So all that factor we go through in a very structured manner. And then we look at the lab work and we try to see whether the patient has normal blood sugar. Are they pre-diabetic? Are they diabetic? If diabetic, is it A1C is elevated? And there are other parameters and family history. At that point, we feel that you might be the right candidate for the medications. Now,
And these are basically, these medications were made for treating diabetes.
yeah, so you are absolutely right that if you look the different group of medication we used now and in the past to manage the diabetes, we are talking mainly of type 2
Yeah.
diabetes and not type 1.
Yeah.
And at that point, we have seen that the metformin, insulin, and glipizide, there are a lot of medicine on the surface in the past, and they are still there, but the benefits are very limited. And some patient where their A1C is high, we may have to consider insulins. Now, insulin also come in different format, but just talk about the basal insulin. The thing is that many patients gain weight when you start on insulin. So we are always looking on the horizon that is something coming where it bring the sugar down and bring the weight also down. And in research and analysis few years back, the group GLP-1 came on the surface, and there's another second part came called GIP. And based on this, we initially realized that they're good to bring the A1C down up to 2 max from the number they have.
So, Dr. Desai, just to make it simpler for the audience, and I just want to explain what GLP-1 is. It's basically the clinical term for weight loss or diabetic medications.
Right. So these are the medications that go and act on a specific area in the body, mostly the brain
Okay.
and the pancreas.
Okay.
And they have a dual triple actions, but main action is that we have a satiety center in the brain, and they are controlling how much we should eat or how much we want, the type, the portion, and all those things. So they try to reset those things in a way that our desire for eating more food slowly start coming down.
Okay.
And the response, as I said, is quite variable. These terms are a little technical, but not going into too much detail. These are the basic functions they have. It found to have good results, but selecting the right patient is still a big challenge for us. Availability of this medicine is another challenge. Coverage by insurance is a third challenge. Patients observing some side effects, mainly not too many, but gastrointestinal, abdominal discomfort, diarrhea, constipation, or sometime not feeling good, especially in the early period. Some are injectable, some are oral. And there's a lot of press going on all this medication, as you know.
Yeah.
It's a rising industry going in billions of dollars. And there are a lot of other associated parameters available. So if we classify this group of patients, those who are diabetic with the A1C above 7, above 8.5, they are the easy group to manage in the sense that they are more likely to get the medicine and less likely to go in a denial.
Okay. From insurance.
From insurance, of course, because these are expensive medicine.
In this country.
Yes, so
Not
that is a good
everywhere
point you raise. You are very smart. There are countries where it is available at a much better price. But you are right, as any other medicine is very expensive here.
Yeah.
And it gone to such a level that there are different pharmacy came up, different people came up. They start running the weight management clinic. So eventually what they found that there is a lot of adverse effect. And as a physician, we are struggling nonstop between safety and efficacy. So one word of caution to the listening audience that please don't buy any of this medicine without consulting your primary care physician or your healthcare provider.
So it seems like there's a lot of counterfeit, fake medication.
Absolutely. You are absolutely on dot. People buy used insulin, which left out, and people have gone in a serious conditions. And that brought the federal government and FDA on an alert situation at one time. And what they have done smartly, that one of the medicines that we are going to talk called Mounjaro is actually a compound which has a GLP-1 and GIP is actually approved as a commercial product.
When you say commercial product,
Means for non-diabetic patients. So this is a off-label use.
oh, so then people are not bending the rules to get.
That is absolutely right.
Okay.
And that came out with a different name, though everything is same.
Yes.
It is called Zepbound.
Zepbound.
And Zepbound went as a skyrocketing marketing. and they actually start selling straight from the company and in the vial. So we'll also like to touch that the availability. So some are available as a one pen like Ozempic,
Okay.
and then it has a multi-dose.
Okay.
And then you have to adjust the dose like 0.25 milligram to 0.5, and then you can use the pen for 4 dose or 6 dose. But still, it is little challenging for many people to while rotate that and adjust it. Other in Mounjaro and Zepbound is a pre-filled syringe, and you just use it. And I also recommend people not to select the belly. Your thigh is a better choice to inject.
So, Dr. Desai, I want to come back to how to take it, and but just so that I'm understanding this correctly, because this is a new topic for me as well. Ozempic is something that was created to treat diabetics.
That is correct.
And then people who were obese started taking it.
And so in the past, there are medicine who are designed for high blood pressure, turn out to be growing hair on the people's head.
I think we all need that medication right now.
That is not me and you.
Yeah.
I'm just joking. But the main part is that got more press and publicity when they found this. And we always concern about weight gain with the insulin. So it was a little tricky situation that the A1C coming down, patient feeling better, but weight is climbing. And we try to balance it with medicine like metformin, but nothing like this, that at one stroke you hit two target. And of course, when you lose weight, your sugars start coming down, you feel good, you are more energetic, you are more active. So that is where this went on a higher level, and it turned out to be kind of a phenomena.
So, and no, I totally agree with you right now. This is what everybody's talking about. So, for someone who's not diabetic and is on Ozempic, what is Ozempic doing inside the body? From like a clinical perspective, what does it go inside and do? And then if you could briefly talk about the benefits apart from weight loss and the side effects.
Excellent question. So as you say that when we use any medicine, there's a clear-cut guideline by the FDA.
Yeah.
And sometimes we divert from that guideline. We call it as a off-label use. And we document in our notes that we are going this for off-label use. And there are a group of people who might be pre-diabetic or maybe normal and definitely struggling with the obesity. And there are many other conditions we call as a metabolic syndrome and all these things. And there is always a thought that can we try this? And sometimes patients are willing to do that.
Yeah.
The patients came out to pay for that, the extra charge, and that is where the Zepbound came in the picture. And initially it was like $799 for certain dose just for 1 month supply.
For Ozempic?
No, for Zepbound.
So Ozempic was specifically for diabetics.
Right.
Zepbound was more for weight loss.
That is
but
correct.
It is way more expensive than Ozempic.
That is correct. So FDA came out and approved this medicine, and they want to sell it straight from the company. So there's a process to be done. Physician got involved. They pay the money and they deliver straight to their home. The only difference is that it is not an injection, one dose per week, but there's a vial, so you have to fill it. But it's not that complicated. People used to do that, and then you use it. So 4 doses, and that price is dramatically coming down, interestingly, because a lot of people are interested. And now it is $499 for
Still
5 milligram. Yeah, and this medicine go in a step-up fashion. So they are at 2.5 milligram to start. We go to 5 milligram. We go to 7.5, 10, 12.5, and 15. So majority of people don't need to go that high, but it depends on case by case. And I'll tell you that the response is so unpredictable. Okay.
Between
So
different people.
So I tried
races.
culture, type of the medicine. So I kind of divide my patient into 6 groups. And the one group is one where they do all the natural, cut down the portion, cut down the calorie, intermittent fasting, 18 hours, 20 hours. And they try to reset their satiety center in a natural way with some other fruits and vegetables and modification and exercise. And the reason I'm telling that even those patients go on medication, we encourage them to follow some of these guidelines.
Yeah.
The second group is a Wegovy, which is there for a long time, is 2.5. Then Ozempic got the highest price. It come in 2.5, 5 onwards. It has a multiple dose. And then Mounjaro came, which has this 2.5 all the way up to 15 milligram. And then came the Zepbound as a second side of the coin, which approved by the FDA mainly for weight management.
So right now, if I were to just see what is in the market, there's Ozempic, there's Zepbound, and there's Mounjaro.
And Wegovy.
Wegovy.
And there's one more that is called Rybelsus. So Rybelsus is a semi-glutide, early generation, like you can think like iPhone 5. And it comes in a 3 milligram, that is a starting dose. It is in 7 milligram and 14 milligram. And the starting dose is mainly for 30 days. And the whole idea FDA has that this medicine is giving little more GI symptoms. So you have to take it on empty stomach, fasting, nothing for 30 minutes. And people experience what you can say, little nausea, vomiting. And I thought, let's try this because some people are afraid of needles. So when we tried this 3 milligram, which is a starting dose, and we are seeing dramatic results, and it is tablet. So the advantage of the tablet is that if there is any adverse effect, like
and this is
more
the
Rybelsus, yeah,
okay.
so you stop it. And I have not taken any patient on higher dose unless, of course, they are diabetic.
Yeah.
And then we take them to 7 milligram, and I think few patients went up to 14, but I have seen a very impressive results. If I come to Ozempic, some people have fantastic results, like losing 10 pound in 30 days to 60 days, and some people have zero response, not at all.
Oh, wow.
Yeah, but we have seen that with Rybelsus also, and there are national data coming out that Mounjaro is superior than Wegovy and Ozempic. Now, I have to bring one thing to audience attention that there are some nice devices we use to monitor the blood sugar. We have Dexcom G7, Freestyle Libra Plus sensor, and there is another phenomenal thing called Stelo. So these are the CGM, we call it, the continuous glucose monitoring. And typically you put it on your arm as a request. I prefer this area on the chest, and they last from 10 to 15 days, and they constantly send the blood sugar level every 5 minutes. Now, people who are diabetic, we do other tests called A1C, but A1C always give you the upper limit. We never see the lower limit. And also, we are curious that those patients who are not diabetic, we don't want that they start using the Ozempic or any other GLP-1 or GLP-1 with the GIP and start going in a low sugar situation.
Oh, yes, yes.
And when you are buying from other people, means I'm talking not through the routine regular channels, you may try to use higher dose because you are not under supervision now and you want to see how quickly I can lose the weight. So it is very essential that when this Zepbound came by FDA, they were very clear that you cannot just call the manufacturer and say, send me 2 vials. You have to go through a registered, certified, licensed physician.
So it's still a prescription drug.
That is correct. Very smart. It is absolutely prescription drug. And there are people who have money or affluence. They also get the prescription and say, we'll pay the full amount. But the point is that this is not a free ride for anybody. Everybody should understand that these are medicine. It has its own adverse effect. And you better go through the right channel and right way under the supervision of your regular healthcare provider and primary care physician.
So, Dr. Desai, you said that, there's Dexcom and
there is a Freestyle Libra 3 sensor plus and Stelo.
So then these basically monitor your blood sugar.
Yeah, they are monitoring your blood sugar. Now, let me a word of caution. There are cases where the number may not coming accurate. But as we move forward, that's getting better and better. And the argument is that when you prick your finger, you are getting the blood glucose. Here, the needle is sitting, sucking the liquid, interstitial fluid, we call it, and there's a little difference between the number. And there are some technological failure also I have observed in my patients. Nothing is perfect, especially when we are dealing with new technology. But we give them a checklist of symptoms to monitor for hypoglycemia.
So, Dr. Desai, before we move into side effects, I want to talk about these glucose
CGM, continuous
patches that
glucose
you put.
monitoring. Yeah.
When you started talking about this, I want to understand in what context. So, when someone begins their journey on, like, say, starting Ozempic or Zepbound, do you recommend that the person, apart from, of course, doing it under primary care's watch,
Observation. Yeah.
they also wear one of these
Oh,
just to be on
absolutely.
the safer side? And
Absolutely.
for how long should they wear it?
Right. So they come typically, like for example, Dexcom, Stelo, they last for 10 days.
Okay.
The Freestyle Libra plus sensor, Libra 3, they go up to 15 days. And that gives pretty good idea that how the effect is coming. Like you see your morning fasting sugar was like around 100. Now it is dropping to 95. But the main goal is to twofold. One is to see that they don't drop too low. And number two, that it also gives some idea that what food has increased the spike in the sugar. So it has added advantage because I'm making it very clear to everybody who are listening that this is not a magic medicine. It is an extra tool to expedite this weight loss process in a very structured way, but you have to use it with a close monitoring, especially that group who is non-diabetic or even pre-diabetic, because they don't want to go in a situation where they suddenly drop the sugar and pass out.
And Dr. Desai, moving on to side effects, we
Right.
talked about the benefits, weight loss, diabetes, and just overall feeling physically better. What are the side effects of these medications?
Right. So there are a lot of research going on, and the data is coming from all over the globe. And there's no major serious side effect detected in the sense that that is a life-threatening. At least sugar is one part. But initial side effect is like nauseating feel, vomiting, abdominal discomfort, loss of appetite. Some are welcomed also, like loss of appetite. But they actually feel that after a few days of using it, the side effects start disappearing.
Just like any other medication.
Right, and the side effect is observed both in the oral tablet and injectable group. The further down side effects, one of the most important checklists we go through is the medullary carcinoma of the thyroid. So there's a gland sitting here for all of us called thyroid gland. Is a butterfly gland. 4 different type of cancer, but the medullary cancer of the thyroid is linked with this GLP and GIP. Now, the testing and research done was more done in the rodent when this notification and label came from FDA. Happy news that that is not translated in the humans. Number one. Number two, that medullary carcinoma of the thyroid is not that common condition we encounter.
Okay.
But we check through the family history and go through some questions to make sure. And if that is the case, based on available data, we recommend them not to use this whole group, any of them. The long-term side effects, that's a very smart question. To be honest with you, I study literature regularly. It's not very clear. But there are some observation coming that people are losing interest in some specific area. What we call like a happy strip in the brain.
Yeah.
And what brings us happy? And of course, food is the first choice. The second will be sex for majority of the people. Then comes the social get together, meeting people, family. And then comes the entertainment. And the last is money. And there are some report projected that people who use Ozempic, Wegovy, GLP in total, not in specific, actually don't feel like drinking alcohol. Also don't feel like smoking. So they are marketing it as a positive effect. But we have to be careful with any new development that we don't want to go in a situation for any of our patients who lost 20 pounds. They are very excited. They are waiting for the dress hanging in the closet for last 5 years to put on and go on the party and have fun time. And you don't feel like engaging on any of this activity. So in my practice, we constantly monitor on a monthly to 3-month increment and go through some questions asking that there is no other long-term effect. And hopefully they will have more data in the future, but we have to be careful. And I always advise people that let's pause after a certain period we might decide that we can hold it for 4 weeks or 3 months. Sometimes we have to hold it because it's not available. Sometimes people insurance decline to cover, or their A1C starts so well. So, and we see that there is a possibility of regaining the weight. And what we suggest when we start on this, that you better start putting all other efforts on the table, meaning start monitoring what you eat, take the picture of your plate and control the portion, control the calorie, control the proportion, put on devices to track your steps and other physical activity, get engaged, make a group. One big anxiety we have nationally and globally that these are helping, but the patient cannot get it, or patient develops some adverse effect, or something comes up and say we cannot give more than 3 months, because there's one group thinking that eventually we'll have more oral tablets. You might get a patch, and we might have support medicine like hypertension medicine, diabetic medicine.
Yeah.
Like I can tell you that in 1977, if somebody called from India, can you send a TV for me? Can you bring a TV for me? Right? When you came in 2000 onwards, please bring iPhone for me. Now they don't ask TV or iPhone, they want Ozempic.
But Ozempic is available in India for
Not
cheaper.
everywhere, not everywhere. It's still limited.
Okay.
But they want Mounjaro. People explore. But for all this group and everybody who are giving them or bringing them or using it, just word of caution that monitor your sugar, monitor your calories, monitor your weight, monitor your physical activity, stay in touch with your regular healthcare provider. Look at what is coming on the horizon and definitely buy or get it from the reliable source.
Dr. Desai, if you were to rate these medications,
Mhm.
which one do you think, after the research that you've done, would you recommend is the safest?
That's $1 million question. That question is, I'm not diplomatic, by the way, but our experience in the medical community and all over, whether you bring. So I will answer this way. We carry the burden almost 80%. P means primary care, family
Sure.
practice, but people are requesting their gynecologist, their obstetrician, their endocrinologist. Of course, they manage the diabetes, but they go even to the orthopedic people. And you are telling me that knee is in trouble because of my weight? Can you just write the script? So, of course, they all divert to us, and we go in a very systematic, structured way. But I am not at the stage to give you the exact answer on that, because I have seen, I give an example. I have this gentleman with 450 pounds, and now the hip is affected, and I suggested that though your weight is very high, the sugar is just on borderline, like pre-diabetic 6.1, you will not qualify for Ozempic. And I gave a sample for 6 doses. And then he left. And when he walked back in 6 weeks, oh my God, it is unbelievable. Almost 18 to 20 pound weight loss in 6 weeks.
Wow.
And even people where he worked are surprised, and he was very happy, and his hip pain is gone. So it is very surprising observation, and it is still not very clear. We'll have more data in coming days, but the response is across the board, it is different. I give a try for 3 months with one, because we don't want to change the medicine that fast. And after 3 months, I change to another compound. But meanwhile, we see that when they try these other things like more fruits, vegetable, cut down the portion, go for a walk, increase activity, there is a contributing factor. So we are getting good data, but I'm not absolutely telling that this is like 1, 2, 3, 4, 5. But at the back of every patient, I have seen this anxiety that if I stop this or I don't get it, what will happen to me?
Yes.
And I say, if you do the right steps, nothing will happen. Don't think that this is like a miracle medicine.
Yeah. So once you stop, you do kind of put on that weight
It
back.
depends. There are some people remain steady, some put on the weight, some has built up all other parameters that we discussed, so they don't need. On the contrary, they come and say, you know what, I'm doing so well, and I don't think I will use it.
Well, Dr. Desai, this has been such an insightful conversation, and I got to learn so much about
So nice.
Ozempic and weight loss medications.
Anything.
Thank you so much once again, and I really appreciate you taking the time out.
Thank you very much
Thank you so
for
much,
your
Dr.
time
Desai.
and
Thank you.
support,
No, thank you for your time.
Thank you. God bless.
This was Rishankajones with Dr. Kartik Desai. If you did like this episode, please like, subscribe, and share. If you have any questions or suggestions, please leave them in the comments section. And you can reach out to Dr. Kartik Desai. He is one of the leading primary care doctors in the state of Maryland. I will be putting down his details in the description. So feel free to reach out to his office in case you want an appointment. Thank you.